Hello, and thank you for joining us. Today, we're talking about how to prepare for a mammogram and some common misconceptions and fears about the experience. We're joined by Natasha Ramirez, who is the site manager for Banner Imaging Baywood Breast Center. Natasha, thank you so much for being here.
Thank you for having me.
All right, so let's go over that appointment. What are the do's and don'ts that you want women to know about for their screening mammogram?
Absolutely. Best thing to do is to wear a two-piece outfit because it's a little bit easier for you because you're going to undress from the waist up. Avoid any lotions, deodorants, or powders, as that can cause artifact on your images, and we might need to do additional pictures for that. You definitely want to bring your referring provider's information, your insurance card, photo ID, and if you have an order from your provider, not that you need one because you can self-request.
Can you talk a little bit more about what we should expect? And everybody wants to know, is it going to hurt?
A lot of people feel that way. A lot of people hear that it's uncomfortable, but that little bit of discomfort for some is really worth that screening exam, to get that exam done. Most people have no problem at all. It's just a slight discomfort because everybody's just different.
And then as far as the images taken, how many are you seeking and when should people expect results?
Okay. We generally take a couple of pictures on both breasts to include all the breast tissue and the axilla. And then usually we'll ask for any previous imaging information so our doctors can do their comparison when they're reading your mammogram for a thorough result. And usually that result will go to your provider in about a week or so. And if we need anything, we will be calling you directly back. If not, if everything's great on your mammogram, you're going to get that letter in the mail says everything's fine.
Now, if someone has dense breasts or breast implants, is there anything different for them that they should know about?
With implants, we take every precaution. We have a special procedure that we do. It's a little bit different than the regular mammogram, and we take additional pictures for the implants, and most people have no problem at all with that. With breast density, what we have is 3D imaging, or tomosynthesis, as the scientific word is, and that actually goes through all the densities of the breast tissue, so it can and capture everything in the breast.
Okay, that's going to give a lot of comfort to people who have concerns about that. Now, another common concern is the radiation exposure. What would you say to people who are worried about that aspect?
Yeah, we do use radiation, but it's very minimal, and doctors approve of this being done every year after the age of 40, and the importance of having the exam outweighs the risk of the radiation.
Natasha, that was such great information. Thank you so much.
You're welcome.
And thank you for watching. To schedule your screening mammogram, just click on the link in the caption.